Hey, it is MG, and welcome to the Reimagine You Lab podcast. You know what time it is. This is the time where we come in. We are always talking about new ideas. We're testing new things. We're trying new things. And of course, we always have an amazing guest. And today is not unusual because I've got an amazing young woman who is here with me today. It is the amazing Ann Garrett Mills. And welcome to the lab. How are you?
I'm doing well, thank you. I
I
think I'll
love it. Thank
I will start by thanking you for calling me an amazing young woman. I don't think anyone has referred to me that way
you.
in a while.
Well, in the lab, hey, you are young, girl. Hey, and then we appreciate you taking the time out today to be with us. Now, Ann, what something I forgot to tell you this, but I do a thing that I call Beyond the Bio. You know, we are in this amazing series for Women's History Month. But Beyond the Bio is where you get the opportunity to introduce yourself because I always think that nobody knows you better than you know you. So if you would, my dear, please just reintroduce yourself for those who are tuning in for the first time and may not have heard. But please share who you are and where you are from and what amazing work you're doing there in Colorado.
Hi, again, my name is Ann Garrett Mills. That is the name my mother gave me when I was born in Colorado. I'm from Denver, Colorado. I'm also known as Sister Ayana, Sister Ado, Dr. Asega. I have many names in the community. Dr. Garrett Mills, Dr. Mills. My job is as the Chief Medical Officer at Aurora Mental Health and Recovery, the second largest mental health center in the metropolitan area of Denver and state of Colorado. But my career and passion is around health and education. And so I practice that today as a chief medical officer in Aurora, professionally by steering that mental health center's medical division and the provision of mental health care in Aurora, which is the most diverse community in Colorado, and I believe the third most diverse community in the United States, and definitely houses the largest number of African American human beings in the state of Colorado. And then my other love is education. So, as a part of that job, we have a training program for people who are interested in medicine. We train medical students and nurses, we train medical assistants, we train residents in psychiatry and fellows in psychiatry. We also provide mental health care, comprehensive mental health care to anyone in Colorado that desires it. And then finally, my other love and passion is education of young people in our community. I'm a former school owner, Tubman Hilliard Global Academy in Colorado, which is a school that closed in 2017, but boasts tons of African, and by tons, I mean in the 100 number of African American students and Hispanic students largely who have matriculated on and gotten college degrees and done other incredible things in the community. So that's who I am.
That's who you are. Amazing. And as we were talking before we came on, I always tell people that sometimes there's always a good show that happens even before we come onto the air. But we were talking before we came on today, and I was asking you about some of the things that you do and the focus around that you have, and you were sharing with me about community and the focus on God and internal history and being true to yourself, because we're going to wanted to have a little bit of conversation today around health, safety, and some of the work and such that you do for women. As we're talking about Women's History Month, talk to me a little bit about just in the work that you do, and as we talk about women's health, women's safety and security and things like that, what are you seeing as areas that we really need that to kind of draw some attention to as we kind of explore for women? What are some of the things that really need to kind of be brought to the forefront as we're thinking about Women's History Month? What would you say?
Sure. I think I'll start from what I would say the bird's eye view, which is these are exciting,
Yeah.
but also very scary times in the lives of women worldwide, in the lives of women in the United States, and particularly in the lives of African American women. Anyone who is really interested in understanding how the forces of 2024 and in the last decade have been impacting the lives of African American women, can pick up a book called Under the Skin by Linda Villarosa, who has written, I think, the definitive text on health equity in African American women. And it's really about the health equity, inequity for African American people. But from a Women's History Month lens, I think the most exciting pieces of her work are really around the health disparities that women in our community struggle with. You know, I am a mother of 6, and I'm a psychiatrist. And I was actually sitting in a lecture hall in Colorado one day, listening to Linda Villarosa, the author of this book, talk about her book. Very exciting for me because she's a homegirl, she's from Colorado, but also because I was interested in this from the perspective of the women that I serve, the people I provide care for. And it was on the eve of one of my nieces giving birth to a baby way too early. That baby was struggling. At the time I was listening to this lecture. And as she began to talk about some of those struggles that we have, particularly Black women, the crisis in this country of Black women and infant mortality and maternal mortality, I was sitting there and I was thinking about the first child I gave birth to, where I came very close to being one of those statistics. And it occurred to me while I was listening to her talk about this inequity that not only was I a part of this, and not only was my niece now a part of this, but we have a long tradition of women struggling in childbirth in this country because we don't have the same access to care, but also because of the impact of racism on our cells, on the mechanical pieces of our cells called our telomeres, on the kind of experiences that we have as Black women in this country, that racism, that microaggressions, that so many of these negative forces, watching people be murdered on social media, so on and so forth, all the things that Black people suffer, the trauma of being a Black woman in this society is a health and safety issue. So I sat there, and as I sat there, I sort of saw this long line of Black women in my head. I heard, you know, Linda Villarosa, this expert, this very intelligent, incredible woman speaking. I felt my own experience. I thought about my niece, and then I thought about all of the women who came before me. So I think it's really important that when we think about health and safety for Black women, that we think about the women whose shoulders we stand on, that we look at what the things that they did that worked. We look at the things that did not work. We look at the work that there is yet to do as community members, as citizens, as individuals in our own lives and in the lives of others, to move ourselves forward.
No, that's so important. You know what I was thinking about as you were speaking, I was thinking about, because being in healthcare is such a vital part. You know, there's a number of coalitions and different resource groups that are active, and that there's work that's going on and being done as an African American female, and I've got 3 children. That we're looking at the data. The data says, hey, we are at risk. And I know that there are my audience that listens to this podcast, you know, hey, they are there, they're listening in. What are some of the things that we need to be doing? Like, give some suggestions here, because I'm always all about, you know what, hey, we're going to bring up a topic, we're going to make suggestions. What is some practical stuff? Because I think a lot of times, you know, those of us that exist in these circles, you're at the lecture, we're getting to Dr. Villarosa's book, and we're paying attention to the information and stuff that's there. But there's some people that are acting as though they're not knowledgeable about these things. But so for those who don't know, like, all right, audience, you're listening in. We're getting ready to, Dr. Asego is going to give us some nuggets here to take back, and you are challenged now with making sure that what you hear here, you take back and you give it to somebody. Each one reach one. So we're giving you some tools that we want you to pass along, because that's one of the things that's what we can do. So give us, Dr. Asego, give us some things that we can pass along.
100%. I think the biggest tool that we can all use is the tool of community. What do I mean by that? I said at the beginning, I think that these are both frightening and exciting times. So what's exciting is exactly what you're talking about. There are coalitions of people, there are groups of people working on these problems. So if you have those skills and talents and interests, you get involved in those coalitions. There is the Colorado Black Health Collaborative in Colorado, and probably lots of similar organizations like that. There are national coalitions. There's the Association of Black Psychologists, there's NAMI, there are a lot of healthcare. NAMI is the National Association of Medical Providers, essentially the Black Physicians Group. And so, did I say NAMI? I didn't mean NAMI. I totally got
NAMI is that.
I know. NAMI is mental health. I'm sorry. NMA, the National Medical Association, NMA and NAMI, both, which I'm a member of both groups, so I get them mixed up. But if there is an organization that you believe that you can give to, you give to that organization. But more importantly, in your own community, whether that be your church community, your neighborhood community, your work community, your friend community, you can be a resource to the people that you love and care about. And let me tell you what I mean by that. If there is someone in your community that is a nurse, a medical assistant, a psychiatrist, a physician, a urologist, doesn't matter what they've got a degree in. If there is a medical person in your community that is open and willing, please reach out to them if you have a concern. They can give you guidance. We also have Dr. Google. Dr. Google will allow you to get online and figure out who in your community can support you. We have churches. There are many churches, and here's the great thing about a church. You can walk into any church at any time, anywhere, and get some support and counseling in that church, in almost any church community. So I think the important thing is to do not allow yourself to be isolated. If you feel like something is wrong, if you have a worry or a concern, reach out to others. And you have your sisters, your mothers, your cousins, your aunts, your neighbors, and they are loaded with wisdom. So if you are in your 20s, and please, women, I'm going to say some things that might be hard for you to hear, but you're in your 20s and you're having some sort of problem with your vagina. You've got some kind of discharge. You don't know what to do. You don't want to talk to your mom or your sister. There is another woman in your community that you can talk to, and you can seek out free support and help. And I say that specifically because, and I specifically got very graphic very quickly, because I think as women, we are afraid to talk about the things that we have been taught are personal. But here's the great news. Many, many women before you and many, many women after you will have the exact same symptoms and experiences, and they will have dealt with them. So if you reach back to women who've already had those experiences and hear how they've dealt with them, along with reaching out to medical or healthcare professionals, you will get the tools, and even doing research on your own, you will get the tools that you need to solve a problem. So I think community is so important. All of those organizations, joining those organizations, being a community member. Maybe you're very private and you only want to talk to your sister or your best friend, but make sure that you have people to reach out to and that you are available if you have expertise or interest in being sought after if someone needs your support and help.
Yes.
I'm going to say one other thing about that. This is because this is something I really wish we had in our communities. I wish if I had a magic wand and could wave it in the air, I wish we had communities of women in every decade of life that could talk about all of the issues in a room together. We just had a full day retreat of all of the women that you can think of. Those who are 90 and older, those who are in their 60s, those who are in their 30s, and those who are young women, 15, 20 kind of age. And we can all talk about sort of the struggles we've had. Here's what I have learned in my 56 years of life is that if I have a struggle and it feels like it's just mine, I'm the only one in this area. When I reach out, I find that other women have had those struggles too. And they're
Absolutely.
their struggles. So that is my wish, that we can have some intergenerational conversations about health and safety for women and security.
Absolutely. You know what? You made so many good points in there. So many good points. And there really are. There's no, the Bible says there's nothing new under the sun. And that's the truth. There isn't. Like there's no silly questions. There's nothing new under the sun. Every struggle that you have ever had, that I've ever had, somebody has had that struggle before. So there's nothing that you have to feel uncomfortable about. You can be naked and unashamed. Don't feel bad about anything that you're going through, that your body is going through. Those intergenerational conversations, and we might need to create that. Like Chris started, and then just let it keep happening, and see how that can come about. Because I think that you're absolutely right. Whenever I have seen those generations come together, there's a whole lot of wisdom that just kind of flows, and it would be incredible. I think it's is it Titus 2:2, where it talks about like the women, the older women teaching the younger, and there's a lot of stuff that I learned from my daughters. There's a lot of things that I learned from them. But don't be afraid. Yeah, resources, getting the information that you need, getting the help that you need. Don't be afraid to ask the questions. There are resources, no matter where you are across the country listening into this. There are resources in your local areas. Reach out for it. And we will have links to the different resources that Ian just named. The links are in the segment. So make sure that you check them out. And one of the other things that you said as we were talking, you were talking about being true to yourself, and finding and enlisting the supports and stuff that you need. And sometimes the support is a little bit different. For one person, it might be education. For somebody else, it may be advocacy. Like sometimes you have found yourself in different situations talking to different people. So for some, it might be they need an advocate. For somebody else, it may be you need prayer. For somebody else, it may be they need access to information. So for somebody else, it might be, you actually need therapy. Talk to us a little bit about how do I identify what it is that I need? I know in different cases, how do I know when I need something? What is it how do I know what it is that I need?
I think again, I have this history of looking at things from the big picture all the way down. So
Yeah.
when you start off at the big picture.
I love that about you.
All of these structures, but when you go all the way down, I think about the inside of a computer or car. Those are things I don't understand, right? Somewhere inside of a computer or car, there is some little gizmo that's not working quite right sometimes. And I am not the person who can figure that out. It is also true for our whole societal system. Sometimes there is pain within one person, and that pain is having an impact on the whole. So I think each of us has a responsibility to spend our lifetimes figuring ourselves out. And we can use all of the resources in the world to do that. Let me give you a little toolbox of where to start. There are certain aspects of a human being that I think every single human being owes themselves an opportunity to explore and to improve and to make better for themselves. One of those is really obviously, and that's the physical. That's what we see, right? Your physical aspect. Are you taking care of yourself? Are you doing the best job you can to ensure that you are functioning at the highest level? For some, that's diet. For some, that's exercise. That looks different for each person around how they choose to do that. But I think one of the first things is the physical. The other is the mental. How are you feeling? How are you doing right now? Are you able to think clearly? Are you able to function? Is your cognition, your ability to solve problems, how are you doing in that realm? If not, either physical or mental, what do you need to do to get where you need to go? Then there's another aspect, and that's emotional. Are you sad? Are you moody? Where are you? And emotional and mental can tie together, and they can all tie to physical because you're one being. Then there is the spiritual. What is your relationship with God? What is your relationship with the universe around you in whatever context or role you think of your spiritual world? How is it doing? Is your spirit, is it being soothed? Is it at ease? Do you give time to yourself to meditate or to pray, to go to church and to take care of those things? And then finally, once you look at all of those things, you have to look at yourself in context of community. What do you need from community and what can you give to community? How do you take care of all of those realms of yourself and all of the iterations of those realms? You take stock on that every single day. If every day you wake up and you say, how am I doing physically, mentally, spiritually, emotionally, and in community, socially is another way of thinking about it. And at night, you say the same thing. And if those things feel acceptable to you, you don't need to do anything to change. There's probably something wrong. If those things feel just adequate to you or you feel fine, that's also just fine. But taking a daily temperature of how you're doing in each realm of your life and then visioning on how you can improve that realm. Let me say one other piece. There is this idea of fulfillment. It is the idea of, some people say prosperity or success. I would say fulfillment. Are you fulfilling the goals that you believe you need to fulfill in order to feel full, for your cup to be full? So that is another temperature that you should take every day. So I think that's what I recommend, is that it is so different for every human being. But again, if something is not right in your spirit, if you are struggling mentally, if you are struggling physically, and all of those things tie together, and there are answers to how to get to a wellness space in any one of those realms.
Yeah, I want to tug a little bit on that fulfillment thread that you just kind of drew out, because I think that's so important. I think a lot of times there's always this push for, I need more, I don't have enough, I'm not enough, and things like that, that we don't leave enough space for just a level of satisfaction, a level of I am fulfilled. Like there's a satisfaction in my life that I'm okay, that I am actually okay. Like I think being a psychiatrist, I know there's lots of people. And do you have a couch in your office? Like, do
I
people
do.
come in
I
and lay down on a
actually do
couch?
have a kitchen
Or
couch.
you do?
Mm-hmm. A kind of a Victorian era couch. Yes, I do indeed.
But I think that, like, we've gotten to a place where, like, people are people fulfilled. I think that the target has gotten so far away, or even when you get close, it's almost like the target is moving. Like we never get to a place of just fulfilled or satisfied. It's like, can people be satisfied with their lives?
I think it is part of human nature to never be completely satisfied as a group. It is why you walk out of your house, if you look at anything that is man-made, so many lives and energies and dreams and skills went into that, right? Just a muffler on a car, or your doorbell, the doorknob, which was invented by an African-American man. Any one of those things, a lot of blood, sweat, tears went into that, and then we perfect on them. I do want to say one thing that I think is really important, especially for women, especially for women of color, and especially for Black women, women of the African diaspora. We have a tendency as a group to not see ourselves as whole human beings, because so often the larger world does not recognize our humanity and the whole of our humanity. That I think it behooves all of us to really, really make sure that we see the whole humanity in Black women and Black girls, in every human being you meet, but specifically in yourself, in Black women and Black girls. I think there is a level of insecurity, and we know about things like imposter syndrome, all of those things, right? I have this recurring nightmare. It's so crazy. I graduated from medical school, but I have this recurring nightmare that someone comes back and says, "You didn't pass calculus in high school, and you got to go back to George Washington." And it is, I've been practicing medicine for 30 years. I just realized, as I say it, 30 years. And I still have this worry that I am not quite good enough. And I think that is common in the minds of women. It is common in the minds of people of color. And it is doubly common in the minds of African women, women of African descent. There is an idea that you're never good enough, right? Your complexion is too light, too dark. Your facial structure is not right. Your hair is weird. Your hair is great. You're this, you're that, you're this, you're that. You're not smart enough. You're that. All of those things take their toll on us. And part of our wellness is loving ourselves first, starting with the shell that we're in, and then spreading that love out. to other people who look like us and who don't look like us but are also us, giving that understanding of love and humanity to other sisters is very, very, very important to the wellness of, to your own personal wellness, to the wellness of others, but also to whether or not you have the fortitude and strength for your fulfillment. Because if you love the woman in the mirror, if you love the woman who knows your secrets, if you love that woman through all of her triumphs, her tragedies, her mistakes, her genius, if you can love that woman that is you, then you can share that love with other women in your community and we'll all be stronger. So I just feel like that's such an important part of fulfillment for us.
It is.
Unique.
Yeah. Yeah. No, I absolutely agree 100%. I think that is the piece that we have to keep on sharing. Like that's the message that we have to keep sharing because I think that's the message that gets lost. And that's why we continually perpetuate the whole imposter syndrome. You're not an imposter. You are enough. You're valuable just as you are. Like that is not I had a conversation with the young lady just on Friday night, and I was like, you know what? Anytime your mind, because she had said to me, sometimes Michelle, I get confused, and and my mind will play tricks on me, and it'll take me places that I don't want it to go. And I said, you know what? You are not confused. Anytime your mind wants to tell you that you're confused, you tell your mind that I am not confused. I am resilient. I am valuable. As a matter of fact, I told her to go get a notebook pad right now. We're going to make some statements that that when you get confused or when you feel like that, these are the things that you're going to say to yourself. Like I believe in affirmations. Like I think that it's important that there are things that we haven't always been told. That wasn't something that I learned as a young girl. It wasn't a tool that my mother had when I was young that she told to me. It was something that as an adult I learned, and as my coach taught me and was like, hey, Michelle, this is something that you can use to help empower yourself. Do this as a practice daily. And I was like, this is helpful for me. This worked for me. And so I share it with other people because I think mentally there are things that we have to do to help ourselves realize that, well, hey, I am enough. I am smart. I remember on the movie The Help, and she would say to the little girl, you're good, you're kind, and you're important. And sometimes you have to remind yourself of that stuff.
And it's important because I think we get other messages in the media, other messages in our workplaces, other messages sometimes in our homes that we are not enough, that we are not beautiful, that we are not smart, that we are not worthy. Yes. And all of those other attributes aside, you are worthy. I think that absolutely is an overwhelming attribute. No matter what other people are thinking or saying or expressing, how they're ignoring you or acknowledging you or something you don't like about yourself, or how they're berating you, regardless of what you've done and what you've overcome, you are worthy. You are worthy. You are worthy. So I love that.
Absolutely right. Yeah, we absolutely, and we have to feed that to ourselves. Now that girl, listen, whatever we need to do, we do it. One of the other things that you mentioned to me too was, as one of those bold and beautiful characteristics of yourself was, you said that you are a connector, like you are good about, and sometimes we are a disservice to others who are around us because sometimes we have a jewel, sometimes we have the things that other people need, and sometimes it's connecting somebody to somebody else, because sometimes I don't have the answer. For I may not have the answer or be the answer for Ann, but somebody I'm connected to may be. So I might not have it, but I know somebody who does. How they would say, I know a guy. I know another gal that can be the person. And I love that because it's so important when you're talking about, as you're performing and developing the community. And talk to me a little bit about here. We like to make sure that we are giving people those tools, those things that they can do practically. When you mention being a connector, how do you do that? Because some people don't know how to do that. How do you connect people? What does being a connector mean?
I think everybody has gifts. And so there
Mhm.
are special gifts. And I'm actually not a specially gifted connector, but I am a committed connector. So if people
Yes.
say to me, I am struggling with X, Y, Z, P, D, Q, and I have any idea or knowledge about somebody who has either survived that thing or any idea or knowledge of someone who knows someone who is, then I will connect those people. And I will sometimes connect them through social meeting. So, for example, there are people who you can give a phone number to and they'll never call it, right? You say, I think you ought to call Dr. X, or I think you ought to call Sister such and such. She knows all about that, and they'll never call. So instead, I facilitate that meeting. There are people who know they need to do something, but feel like they cannot get it done themselves. And at those points in time, if there is something I have some level of expertise in, particularly around education or health or safety, I say, let me be your advocate. If not, I connect them with another advocate. And here's what I will tell you. In my darkest days in my life, people connected me to resources that were completely foreign to anything I have had to deal with, right? So I have my area of expertise, but there's a lot of things out there I don't know anything about. Can't fix a car to save my life. So I'll just give an example. One day my garage door broke and my car was stuck in my garage. Couldn't get it out. Some spring went off my garage. It was crazy. And it was because of a connection whose connection whose connection I had a human being in my presence who happened to know another connection. And it led me to solve my problems. And I think that is because I have made myself available as a connector, that people are willing then to connect me. And so, what you do when you reach out for help is you also then become a connection for that person and you build community. And that's really, I think, what's important. The other thing is we have tools that, boy, I wish when I was growing up in the 70s, we had these tools, right? We have tools like the lists online and the list of Black contractors and this on Facebook and that on. And even if you don't know something, but you know something on social media or you've seen it, we're able to connect each other. So I think building communities like that are important. The other thing is that there are incredible professional connectors. Here in Denver, down on 5 Points, we have this Brother Jeff's Cultural Cafe. Brother Jeff writes a book that lists every Black mental health professional and every Black plumber and every Black person that does whatever. And so that's a connection. So I think if you know someone is in need, you could be that resource to connect them to the resource. And that's what I mean when I say I'm a connector.
I love it. I love it. I think that's important. And I think that that's huge because most of the time people are so reluctant to connect people or connect things or say that they're even a connector. It's like, hey, you never know when you might need something or somebody, and so be willing to connect and then also, be good at whatever it is that you do when somebody connects you. Like if we give out your name and telephone number for something that you do, please
Absolutely.
do it. Follow up on what it is that you do. Be good at what you do when we're
You,
connecting.
one
Go
other
ahead.
thing I just want to say really quickly, because I don't want to give out the history. I'm a little bit of a history buff, is the truth. I don't want
Yes.
to forget the history part of Women's History Month. The
Yes.
history of Black women is phenomenal. If you have any interest whatsoever in reading or watching documentaries with an eye toward the history of what Black women have accomplished, it is also a toolbox of resources that you too can use to do things. So if you look back at the lives of Black women like Mary McLeod Bethune and how she created an institution that's still here. And by the way, anybody that's in Florida that wants to drive down Pasteur University will see the most beautiful statue of a Black woman I have ever seen in the United States. towering above, I can't remember what it's called, like Daytona Speedway or something. I can't remember what the street is called, but it is looking at her life and her history. It gives you tools around leadership and being a Black woman. And there are so many other incredible women: Harriet Tubman, Sojourner Truth, Fannie Lou Hamer. I mean, the list of incredible Black women goes on and on. And I think studying what they have done, how they dealt with their circumstances, is also in some ways a resource. So I just wanted to give that a free plug.
No, that's good. Yeah. Oh, absolutely. That was a good one. I'm gonna have to get the full list and send that out, because that's a good one. We definitely don't want to forget what the meaning of this month is really all about, and giving an ode to all of the women that have come, the African American women who have come before us, that have established their legacy. Before we get out of here, because I swear the time goes by so quickly, and what would you say is your biggest piece of advice that you would share on this Women's History Month, in the work that you do in health, in education, the passions that you have for both? I know that we talked about women's health and safety. You're a practicing psychiatrist, but what would you say is the biggest piece of advice that you would give as we close out this segment today, that you would like to share?
I'm terrible about remembering specific phrases, but there is a prayer called the Serenity Prayer. And essentially that prayer says, there are things I can accomplish and I should. And there are things that maybe I am not in a position to accomplish, and I should recognize that too. And there's wisdom there. And I think every single woman is capable of doing something that other women are not capable of doing. You have a superpower. Your niche is your niche and is specific to you. And it is special, and it is blessed, and it is incredible. Follow your niche. And the way that you follow your niche is by following your heart, your dreams, your passions, the things that come to you in prayer, the things you know and feel are right. Even if they seem odd or peculiar or not the right thing to those around you, follow those passions and try to actualize them. And that would be the best advice that I have for any woman who is looking to actualize herself, and recognize that change comes. It may not be the path that you're hoping for. It may be something different, but you are here for a reason and a purpose, and you impact the world around you.
That, my friend, I can only say amen. So good. And it has been a pleasure having you on today. Thank you so much for being here. You are a jewel, and I look forward to you coming back sometime in the future. It has been a blessing. As a matter of fact, I know you're going to be here at the end of the month as we close out Women's History Month. So thank you for being here. Oh, I know that all. Oh, absolutely. Absolutely, my dear. Well, those of you that tuned in today, those of you who have heard it on the replay, those of you, if this was your first time, I know it won't be your last. If you have not subscribed, thank you. So first of all, thank you for tuning in. If you have not subscribed to the Reimagine You Lab podcast, please make sure you do. Share this with your friends, family, co-workers. This is the place where we come in, we test ideas, we listen to and learn from wise, witty men and women. This is part of our Women's History Month series. I'm so glad that you came in with us today. We drop a new episode every Friday. Make sure that you come back, follow us, help us get to that 10,000 subscribers by the end of this month. I look forward to seeing you here next week. God bless you, and we will see you next Friday.